Mental health has been at the forefront of a national conversation recently. Our emotional, psychological, and social well-being important at every stage of life. But Black Americans are far less likely to seek help. And there's also the issue of unequal access to care. Joining us this afternoon is Dr. Alduan Tartt, a Christian psychologist with more than 1.5 million views on YouTube and who specializes in mental health counseling. Thank you for being with us this afternoon, Dr. Tartt.
Hey, I'm glad to be here for such an important interview. Thanks for having me.
I wanted to start by asking you or having you describe for us what your approach as a Christian psychologist.
So I'm trained both ways. So I have I have a degree from Morehouse College, University of Michigan, in clinical psychology, but I've also been in ministry for the last 6 or 7 years. So I provide the practical application and meet people where they are with their faith, because so many people of color just incorporate faith when it comes to healing. So we make sure they don't compete, that they actually combine.
Okay. And a lot of people that I say a lot, but that I've spoken with people, and there are people that will say, well, I don't need counseling from a medical professional. I'll just talk to my minister. But I think that the combination of the two things really probably is an important asset when you are dealing with people in the African American community.
Well, I know from being a minister, but also talking to pastors, is that most churches have actually started mental health ministries for that reason, is that they found that while they were equipped to provide spiritual counseling and pastoral care and engagement and community service, they were not prepared or equipped to provide mental health, but that's where people were comfortable coming. Mm-hmm. So like part of the ad council has partnered with some of the top ministers and pastors and psychologists to actually combine the two to make sure that almost every church is able to have a mental health ministry or something to that effect to meet people where they are.
Talk to me a little bit about this idea that communities of color don't take advantage of formal mental health services often enough. What is the issue? What is the disconnect in your experience? Why is that the case?
Well, one, there's been some distrust of different systems. I mean, we see what's recently happened with the police. People don't trust social services. They don't trust community mental health. But now what we're seeing, and this is why I do what I do, when they see faces of color, they recognize only like 4% of African-American psychologists nationwide are African-American males. And so when they don't see people that look like them, that's a deterrent, but also there's a fear and lack of exposure. So I'm actually happy that so many psychologists are getting opportunities in movies and reality TV shows so that people can see, hey, mental health is real. And then also the capacity has not been there, right? Mm-hmm. So we have so many needs, and then the community mental health clinic can only meet so many people. So we have a number of providers, and the National Association of Mental Illness, NAMI, has made sure here in Georgia to actually start reimbursing. They're pushing the state of Georgia to reimburse anyone to go into mental health so that we have enough providers, so they get college reimbursement for actually being able to do this, so we have the numbers to meet the need.
You mentioned Black men at one point, African-American men who are more unlikely to seek this kind of help than other people. We've also seen a rise in the rate of suicide among younger Black men. Talk to me a little bit about why that is, and what do you think is impacting these suicide numbers?
Well, we know for African-American youth 15 to 24, suicide is now the second leading cause of death. I mean, that's sad. And it's only increased since COVID. So if we're talking about young people, I mean, we're looking at social isolation. We are addicted to our phones. Kids are TikToking and kids are on social media, but they're not connected in real life, right? And so one, we have to make sure that our sons and our daughters, because it's especially damaging damaging to teenagers. Matter of fact, 1 in 10 teenage girls have had suicidal ideation in the last year. I know we're talking about males, but I wanted to put that out there. So one, we have to make sure that our boys are connected. Also, our boys are competent. A big risk factor, boys who feel incompetent. What I mean by that is they don't feel like they measure up. They don't feel like they're good at anything. That's a core of a young male's psyche and ego. And if he's failing at school and is not good at sports, doesn't find anything special, that's a risk factor. Then also having an alternative lifestyle, being part of the LGBTQT plus community. It's a hostile world out there. So you can imagine being a young black male trying to find yourself and then the world possibly being hostile. Those risk factors, in addition to just household stress with divorces, social media, feeling rejected at school, having to deal with social isolation, feeling a lot of boys report not being able to trust their friends, having unreliable friends to confide in. All that associates with poor mental health and suicidal ideation.
How do you get on top of that? How does a parent, a teacher, a coach, what are you looking for? How do you recognize this so perhaps you can intervene before it gets to that point?
I'll tell you something that you can do that works for every school. The wrong approach is asking, are you okay? Are you good? Do you need help? Boys are programmed to say, no, I'm good. Even in the church, how you doing? I'm blessed and highly favored, right? All right. So what you want to do is you want to actually ask the question in a different way. It's called motivational interviewing. So you say on a scale of 1 to 10, how happy are you today? How satisfied are you with your life? Right? You're going to be shocked how many boys and how many men will say a 3, a 2, a 1, a 5, right? And then you ask them why. You ask them what's working, so you can start in the positive to get them to open up about why a 5 and not a 1. So this part is working. And then ask them what would make your life better, or what's making your life stressful. And you'd be surprised how many males of all ages begin to open up. It's asking the question in an open-ended, objective way from a Likert scale 1 to 10 versus asking that question, which is, are you okay? Where men don't think that they're programmed to say, no, I'm not okay.
Dr. Tartt, one of the things we have been talking about here at the station is a recent video we saw, Tyree Nichols beaten by those officers in Memphis. And many people have questioned, the impact of the public seeing those videos. We've even heard people refer to it as some sort of, violent porn. Just talk to me a little bit about the psychological impact of seeing this young black man beaten essentially to death on camera. And of course, it's not the first time we've seen something like this in this country.
So it's something called indirect trauma. Indirect trauma is where we are indirectly affected by the trauma simply by watching it. Now, why? It's called linked fate, where our fate seems linked. So as a mother of a black boy, you feel like this could happen to my son. As a black man, this could happen. As a non-police officer, like I could just be at a traffic stop, not break a single law, even though they said I did, and be kidnapped from my car and beaten to death, all in a matter of minutes. Not get medical response, not be transported, not be cared for, and be treated less than a human. So watching it is absolutely damaging. And so I think that one of the things that was good about the release of the video is that they warned the public, hey, this video is coming out on this particular date. And what you found was a lot of people actually decided not to watch the video to protect their own mental health. They knew there was nothing they could do to fix what they were getting ready to see. They remembered how they felt looking at Philando Castile and Gardner, and the list goes on, Sandra Bland. And so they're trying to protect their peace and their mental health because people are already stressed with record layoffs, recession, COVID, losses, depression. People said, I can't handle this, right? So a lot of people chose to back away from watching that video. And then also, there's this concept called implicit bias. Mm-hmm. Implicit bias is when we're not really conscious of the biases that we have towards women, towards people of color, towards people from a different country, towards immigrants, towards those from the LGBTQT plus community. And what police divisions are doing across the country is getting this implicit bias training so that hopefully they can screen out in the beginning who's biased, even against their own race. What we know from the studies is African American cops and non-African American cops have the same negative view of the general public because they see them as criminals.
Is your feeling that we need to see that? There, people will tell you we need to see that video because we need to know what's going on, and then you have other people say, I would, as you said, I would rather not see it for whatever their reason might be. Is it important that we see this, that we, I guess, have the choice to make up our own minds about what happened, or fight for change, or whatever your reaction to this kind of video is going to be?
Let's talk about it. As parents, your children should not see this video. All right. I can tell you, as a child psychologist, children come in afraid of all the police. So they're afraid of security officers at work. They're afraid of police officers who are in the neighborhood, right? And what are children going to do with that information? So we know that a lot of people struggle with access to health care, either not having adequate health care, insurance companies not offering the same type of mental health coverage as they do for physical ailments at a time where mental health is at a record high. That's something that we're working to change, across the nation, especially here in Georgia. But no, I don't think children should watch it. Now, I do think that the powers that be, the attorneys, the legal system, and people who want to see it should watch it. But after that, you have to make sure that you take care of yourself and being able to discuss and talk about what you saw. Whatever we talk about, we get distance from. Whatever we can't talk about, which is why suicide affects, Black males more than women, and men in general are the more likely ones to commit suicide, is that we don't talk, we don't emote, we don't express our emotions, we keep them inside, and it metastasizes. So if you already have a youth who's at home who's already fragile, or if you are already stressed out, watching that video is not going to be good for your mental health, but it is going to be good for the powers that be to make sure that justice is served, because we do need to see that justice is served versus the police sweeping this under the radar because we won't feel safe.
And before I let you go, I've got one last question for you, because it has been a topic of discussion, in particular with this Nichols case. A lot of people were surprised initially to see that it was 5 Black officers, and you touched on this before. Because I think there was a feeling that, well, they wouldn't do that to another young Black man. Just talk to me a little bit about the psychology that is involved in seeing this. I guess a lot of people approached it as if it's 5 Black men, they're not going to do it. And then others would say, but the problem is not the color of their skin, it is the type of police officer they are.
So we look at the character of the men who are policing. One of the things that the police will tell you is that they're struggling to find suitable police officers to meet the need, because very few people want to be police officers. There's record numbers of police officers who are coming off of the streets and going for desk jobs, going for administrative jobs at the pressure of their family and the fact that it's hostile. So the police pull up, and every time they pull up, there's a camera. They have to wear body armor. So part of it is we need to do things to actually increase the talent. Then we have to increase the supervision and the training of officers. But the other piece is, and you saw the Memphis police chiefs, and they're disabling the Scorpion unit. Think about the psychology of the name, right? A Scorpion unit. All right, that makes it sound like you're attacking the general public. That is not a protective factor. And then if you have this fraternity effect, a mob effect of where we're going to teach someone a lesson, we're going to all be in this together, because there is this space. Police will tell you they're faced with either being a rat by telling on fellow police officers and not getting backup the next time they call for it, or actually being a part of something that they really psychologically don't want to be a part of and losing their job and taking a life. So they have to do something about that dilemma, and the psychology that goes within the police force is the worst thing you can be is a rat, because it could lead to your own demise and lack of safety, because they really don't respond to your calls for backup if you snitch.
Dr. Alduan Tartt, it has been a pleasure talking with you this afternoon. I can send folks to your website. It's drtartt.com, right?
Yes. So if you need mental health, relationships, marriage. I'm there to serve, and I just want more African American people to see that psychology is okay. We can combine faith and psychology so you can be well.
All right. Thank you so much for spending some time with us this afternoon.
Thanks for having me. Thanks for what you do.
Sandra Bookman and Here and Now will be right back.